Welcome to the Hank Cisco Show, ladies and gentlemen. I have to apologize. My voice, I woke up this morning and the voice is someplace else. But the show must go on. I don't cancel no shows. And just like a boxer, I never lost a fight in the dressing room. I'm going to come right in the ring. So my show today is my eye doctor. He's the one that keeps me looking out there, see what's going on, you know. So for many years, and I would say that he is one of the top doctors in the country. And he does a lot of charitable work, many years, that he went out in different third countries, I think they call it third countries, whatever it is, and helped people that had eye problems. So he's more than just a doctor, you know, and family man. And, you know, one thing I like about his office, you know, it's you're not a number when you go in there. The receptionist talks to you nice, and then you get the first person who looks at you, you know, and one of the girls, and you're not a number. You get to know people that live around here. And the one girl is just checking my eyes. One of the aides, I guess you call them aides. She says, "I know you. You're Hank Cisco. You used to be a policeman." I said, "Yeah, how do you know?" "My father was a sergeant in Plymouth Township, Fiorello." I said, "Oh, I know him." So what I'm talking about here is an office with a doctor that's right here and has a concern for people, and one of the top in the country. So I did a little, research and Google. If you want to have some fun, Google eyes, and you'll see a lot of stuff. Do you know there's so many songs that are about eyes? When Irish eyes are smiling, I only have eyes for you. Smoke it's in your eyes. Spanish eyes, la da da. This is my real voice. I'll come back one of these days. But another thing about superstitious about when you sneeze, people think that when you sneeze, you close your eyes. If not, your eyes will pop out. Well, that's not true. Some people have their eyes open and they sneeze and your eyes don't pop out. So there are little things about the eye. So what am I talking about eyes? Because I have the top eye doctor to talk to you and help you in a lot of things that care. You need care for eyes. So, welcome to the Hank Cisco Show, Doctor. You're going to do a lot of talking because I'm running out of gas here.
Okay.
What is new in the cataract? You did my eyes, cataract.
How long ago do you think that was?
Oh my God!
Had to be at least 10,
I
10
was
15
the
years.
detective end, yeah.
Yeah. Oh wow.
Yeah.
Because things have changed so, Frank. You
Yeah, but
can't
you did
imagine.
the other operation that I don't have to wear glasses. You're going to tell me about that too.
Right.
Go ahead.
Let's talk about what's new in cataract surgery.
Good.
You know, they did a nice article in the Montgomery Herald a few weeks ago about our new laser.
Times Herald.
Times Herald, right.
Northtown.
Yeah.
Rah, rah, rah.
There we are.
Dan
Local.
Husky, the editor. Go ahead.
So I think I ought to talk with the audience first so they understand what a cataract is, and I can show them right here on this model, and we'll talk about what's new. This is a model of your eye. Remember you said your eye might pop out if you sneeze, so this is an eye cut in half so we can sort of look inside, because your eye sits in the orbit and we only see the very front of it, but it's a large ball. And this eye acts like an old style camera in that there's lens out front and then there's an actual lens inside the eye. And those two lenses work together to focus light on the film in the back of the eye, which is called the retina. And that's just like an old film camera. The image is projected there and it goes out this cable to the brain, and then we see things like I see I'm on the show with Hank Cisco. So there's a lot of things that can happen to eyes, and there's a couple of messages I want to get across today, and that is everybody should have their eyes checked for glaucoma.
Yeah, tell me about that.
We'll talk a little bit about that because glaucoma is much more prevalent in the African American than in the normal population, and about 10% of the African Americans above the age of 40 have glaucoma. And just recently, today, I saw an elderly gentleman and he's already blind from glaucoma, even though he maybe had some drops and everything.
Is that a coating that comes over the eyes, or?
No. Let's talk about this eye model, I think, which is very helpful. First of all, in the normal eye, everything is clear, and the things go through the light goes through the front, it goes through this lens, and goes to the back of the eye. Now, this cable that runs the image to our brain and helps us to see, that's what gets damaged in glaucoma.
Oh, okay.
Because actually what happens is the eye gets too firm, parts of the eye that make the fluid and part of the eye that lets the fluid out. It's sort of like a lake in that one end the stream is coming in and the other end there's a dam and there's an overflow, so it keeps the lake level. And that's how the eye works. But in certain people it's as though the dam gets clogged, more like a beaver dam where there's sticks. And then there gets too much mud and then the lake rises, and that in the eye there's no place for the water to go, so the pressure goes up. Well, that'd be okay, except blood is trying to get into the eye, and these nerves are being get nutrients from the flow from the brain, and that causes damage here if the pressure's too high in the eye. We can show a little video of that to your audience.
You have a video?
Yeah, we'll show them that. And now I wanted to show you what happens with cataracts. Now, in a cataract, this human lens, something inside our eye, actually becomes cloudy.
Ah, I know.
Right.
I had it.
And so
one eye was complete, I couldn't see it.
I remember that. I remember that. So when this lens becomes cloudy, then the issue there is that it blocks the light. Now, you may have heard the term, my cataracts have to get ripe. Now,
yeah, that's another thing. Right.
That's an old term because in the old days, we really couldn't take out a cataract until it got completely dark. But today, if a cataract even forms a little bit, we can take it out once it bothers your vision. Now, recently, I just did a young boy, a 14-year-old, because you might wonder, well, when can you get a cataract? Well, 14? Actually, I've operated on a 6-month-old, and I've operated on a 100-year-old.
What happened?
Well, in the 14-year-old, it's very interesting. I want this message to get out to your audience because they're boys, right? And they were horsing around, and guess what they were doing? They were twisting wet towels and flicking them. Oh. Well, that wet towel, you know, when it makes that snap, it's breaking the sound barrier. It's going 600 miles an hour.
Wow.
So this unfortunate boy, just when the snap hit, it hit the very front of his eye, and it caused a cataract, a traumatic cataract in a 14-year-old, which we just took out. And that's actually, they're doing an article in the health section of the Inquirer, because it's really important. You know, I have 5 children, and it always annoys me because they tend to throw things at each other in their faces, you know? Take that, you know? And you never hit anybody in the face, did you, Hank, when you were fighting, did you? That's where the home run is, right? Right. So you got to hit that casa. So the hitting the face is sort of what we do when we're aggressive, and the eyes are often a target. And so I really try to make people understand that flying objects, those whipping the towels, throwing balls, all that can really injure somebody very seriously. But I wanted to get back. In this young boy, part of the problem is when you're young, remember when you were young?
Hey, yeah.
Just yesterday.
Well,
you could pick up something and read it, right? I see this great picture of you with the filing cabinet. Back then, you're not wearing glasses because you could see, right? You pick it up, you could read.
Yeah.
Well, what happens is this lens that we have can focus. And as we age, it gets sort of darker and stiff.
Yeah.
And then it can't focus anymore. And around 40, you start wearing reading glasses. Well, the big news in cataract surgery, not only can we do the operation now with a laser, but when we put a new lens inside the eye, we actually have a type...
When you put a new lens in?
We put a new lens, and this is called the crystal lens. It's made by Bausch & Lomb. Now, the beauty of this lens, and you don't have this lens in both your eyes, but the newer lens, it actually flexes when it goes in the eye.
Oh.
So when you're reading, the eye adjusts a little for near, and then when you look in the distance, it goes to distance.
Focusing.
And it focuses. And it's called pseudo-accommodation, because the ability we have when we're young to read is called accommodation. And the loss of that ability is called presbyopia, or old vision, because when we get old, this thing doesn't bend anymore. So we take out the human lens, and also occasionally, even people wearing thick glasses.
Like Coca-Cola.
Like those thick ones, you know?
Coca-Cola glasses.
I don't want to mention anybody in the audience
Well,
here.
Coca-Cola, that's what they call them in the Army.
Right. So those thick glasses, what we can do, instead of having those thick glasses out front, we take out this human lens and we put in a powerful implant inside the eye that flexes.
That's what I have.
Yes. And that's why you don't wear glasses for most things anymore.
Right.
Now, this is, of course, a model. It's not the size. The real size is about the size of a dime. Now, the interesting thing about all this is this operation only takes about 20 minutes.
Yeah, right.
And of course, we have to get inside the eye, and I have a nice video clip I'm going to show your audience about cataract surgery with a new laser.
It shows the actual operation?
It will show the operation. Now, the human lens, of course, we have to get in the eye to take this lens out, right? When this gets cloudy, we have to make incisions and get inside the eye and suck that out. Now, we used to use diamond knives to make these cuts into the eye. And now, believe it or not, have you ever seen those like laser cut carvings, you know, that are cut in wood with a laser?
Oh, yeah.
Or my kids, we make models.
That's the latest thing, right?
That's the latest thing. And you know, Hank, I would use the latest thing, right?
I know. You're top shelf.
That's my thing.
Right.
So we go inside the eye, making these openings with a laser, and at the same time, we can correct astigmatism. Now, people say, gee, you know, I have astigmatism. We can't do anything about that, right? Well, fact of the matter is we can correct astigmatism. And it's as though the front of the eye was slightly distorted and had more of a curve in one way than the other. Sort of like this would look a little bit like a part of a football. And the way we correct that actually is we sort of take the laces out of the football and it gets more like a basketball.
Okay.
And that makes it more round. And so we can combine the laser operation with the cataract operation, correct the astigmatism, focus on the back of the eye, and also allow that lens to flex.
Yeah. Well, when I remember people were afraid to get the cataracts.
Right.
Because after they had operated on it, they had to cover for a day or two. They couldn't see. I think I got my operation just when times changed.
Right.
Because you told me you were going to operate, you know, and he says, all right. So I went over to your office. You have an office over in Upper Merion. You have one in Plymouth.
Right.
You know, and one in Radnor too, someplace, right? And he says, you want your wife to watch the operation? I says, yeah. So my wife, she's not afraid of anything, you know. When we went to Italy, went up to the Leaning Tower, what do you call up there? She's on top, you know, she wasn't afraid of anything. So she's watching, right? And then you gave a film of the operation. Oh, yeah. But I didn't watch it.
Don't want to watch
Same
that.
thing, I had a heart operation in July.
Really?
Bypass, Dr. Anderson.
Oh.
And he's going to give me the operation. He's going to show it, so I'm going to put it on my show here. But I won't watch it.
Well, you know, Hank, that's what's so amazing.
But it only took around, what'd you say, how many minutes?
About 20 minutes, the whole operation.
She was standing there watching and you were working on me.
Yeah.
Go ahead.
Now today, of course, we use a laser to do all that operation, and I just sort of monitor things, and I do the part where I suck out the cataract after it's all been cut up, and then I put this implant back in there. Yeah. Now, the interesting...
But Anthony told me that if I wanted to get the reading, I had to get dollar glasses.
Yeah. Well, you don't need them, though. You read pretty well.
No, I can read it, right. But I always like to, you know, enlarge, you know.
A little larger.
When I go into a store, I want a big hoagie. I want a big thing. So I want the words to be big, you know.
I like it. So one of the things, Hank, that we've done now since your operation is that we sort of adjust it so people can actually read.
Since my operation, tell me how many things changed to the benefit of people.
Well, the first thing is that now we make the incisions. Instead of using a diamond knife, we use a laser to cut the incisions. Then we do Lasik. That's an operation I do on young people so they don't need to wear glasses anymore. I then do Lasik on the front of the eye so that you won't need glasses. I put in this flexible implant. So that implant sits there and flexes so you can read without glasses. In fact, you can see in the distance, in the intermediate, your computer, and you can read about 90% of the population that I do cataract surgery on who get the crystal lens never use glasses again.
Right.
But it's people, not everyone.
You're right about they had to get ripe. You don't have to wait for that. That's out there. And there's a big word here. Where is it? What is this?
Astigmatism.
I'll never be able to pronounce that. Tell me what it is.
Well, instead of the eye being shaped like a basketball, it's shaped more like a football.
Yeah.
And I have a little prop here that I'll show you, sort of how the front of the eye looks. My assistant is going to kindly hand this to me. Thank you. Or you're going to throw it? Thank you very much.
I get on camera, that's okay.
So, and it's an Eagles football. You know, I just operated on, I operate on LaShawn McCoy.
Oh, yeah. Ladies and gentlemen, you go in his office, you'll see pictures of different celebrities, basketball players and football players.
Yeah, Larry Brown,
they don't
Matt
have
Geiger.
my picture there yet.
Well, we'll have to get one of these
We're gonna
pictures.
Get one of them over there.
So the front of the eye, instead of being like a nice smooth curve and looking like a basketball here, like all round, it's more misshapen, like a football. Okay? And so these curves are different in different directions. And as I was explaining to you, like the laces of a foot, if we loosen those laces, the ball would expand out and get more round.
Yeah.
And that's how we correct astigmatism. We'll get that Eagles out there, by making those incisions so the front of the eye reshapes. Now, after that, we then do Lasik. I have an excimer laser.
Tell me about the Lasik now. That's
right. So, you know,
what's the Lasik mean?
That means laser-assisted in situ keratomelusis. I knew you were going to ask me that. But we call it Lasik. We call it Lasik. And
that's why I say he's my top doctor, right?
With Lasik, everybody's cornea is slightly different. And, you know, glasses are all different powers, right? You look at them, they distort things. They're stronger or weaker, thicker or thinner. We take that prescription, your glasses prescription, and sculpt it onto the surface of your eye using a laser to control it. And actually, the laser vaporizes certain areas as though it's carefully sculpted.
The laser is like a beam?
It's a beam of light, yes. And it's a focused beam. So there's power like lightning. When it goes through the air, it actually causes an explosion in the air. And when you hear the thunder, it's actually the clap of the air then coming together again. And actually, that's called a plasma. And we use a laser, a microscopic laser that forms this plasma, this high energy spot that vaporizes everything near it and then cuts at the same moment and then is gone in a second. And that's why you hear this little zzz when you were using the laser. There's a
sound,
yes, but it's going extremely fast, and rather hearing a clap of thunder, it's so 1,000 people are clapping all together. And so you don't hear that individual clap. So the combination of Lasik, getting young people, like for LaShawn McCoy, he had Lasik, and of course he had a pretty good season. That was 2 years ago I did his. Yeah, Bobby Taylor, and remember Chad Lewis, the guy who caught that pass in the end zone? Well, I did his Lasik too, and it's interesting because when you wear contacts, people don't understand that contacts are pretty dangerous. The incidence of infection, and I have a gentleman actually I'm operating on next week, it's about 1 in 10,000 per year. Now, when we do Lasik, you're not going to need contacts again, and the incidence of a serious problem is about 1 in 100,000. I don't know if I told you, Frank, that I got certified as a Vision Lock surgeon. Now, Vision Lock is a company that actually ensures the outcome, sort of like a warranty. Anything happens, we give you $1 million check. Because we're so confident now that we can get a great result, and the outcomes are so safe and consistent that it's an insurable event. It's sort of like when you go to Best Buy and you buy a TV.
I think we sum this up that people are afraid to go, you know. But I know when I was a policeman, we took a course in safety and first aid. Now people, sometimes you go there, some bleeding, see no blood, faint. There's a little bit of a cut, a lot of blood. So we tell them, look, watch it away, look it away and see what you got. You got a little cut there, don't worry about it. So Education removes fear. If you have fear to take care of your eyes, you got a problem. So go get checked. There's nothing wrong. And let me tell you, there's no pain. Let me tell you, I've had colon cancer, the other prostate cancer. I got a pacemaker, got all this stuff, and I'm still bobbing and weaving because I got the top people. And you don't have to go to Hong Kong, Yokohama. We got the top doctors in this area, okay? That's heart doctors and hip. I do hip replacements too. Oh my God, I'm a walking monkey or something.
The bionic man.
But thank God it's people like you that are educating and educating people and helping people. So go ahead.
That's really, I couldn't agree more. We actually have some of our staff who sit down with patients and explain to them everything that's going on. We have these great videos, and actually on our website, you can go on and they'll talk about cataracts, and also I do something called VidScripts there where I talk about what it's like to come to our office, and all this education is very, very, very helpful. And it's all on the internet. It's really, truly amazing. Yeah. But once you get to my office, then you get personal care.
I guarantee it. You believe me.
Yeah.
You believe me, okay? I've been around a lot of corners, and it's one of the best, okay? All right, how about glasses? What's the scoop on glasses? People wearing glasses, they're still wearing glasses.
Well, you know why they still wear glasses? Because they're afraid of laser vision correction. There's really no need to wear glasses. I don't wear glasses. Oh. You don't wear glasses. Oh. Because I see perfectly.
I did.
Yeah.
Before I went to you.
You know, I had my Lasik now 14 years ago. And my story is sort of interesting. As a matter of fact, they wrote it up in one of our professional journals. It's a great story.
Let me hold it up here.
Refractive surgery in refractive surgeons, and it's called Walking the Walk.
Walking the Walk.
Yeah, isn't that interesting? And it's a story, and you can get it online. It's in Ocular Surgery News. If you just put in Siepster, Walking the Walk, or Siepster Lasik, you can get to this article. It's a story about how I had my laser vision correction and what it was like and how I see today and why I had it done. You know, 40% of eye surgeons who can have laser vision correction have had it. 40, almost half. Because we know the technology, we're educated, we understand, and the risk is so minuscule, really, there's nothing to be afraid of.
You know, one other thing I like about your office, when you go in there, you have one what do you call them, aides or?
Staff. Technician.
One will check this here, the other one will check this here, but you're the last guy.
Right.
You're the last guy. You look at all that, the report, and you come up with the decision, what's best for you.
That's really interesting,
That's
Frank.
Good.
Hank, because we
because I don't want to go you some place where I'm just a number. 2, 4 over here. Yeah. Oh yeah. Yeah. Sit down. Shut up. Okay.
Well, the key there, we often tell patients when they make an appointment in our office that you can be there for up to 2 hours. And you're only going to see the doctor really for a short time, because what I'm doing in the background, the technical team does some tests, and then they come to me and, what else does this gentleman need or this woman need, doctor? Would you want us to do a cell count? Do you want us to do orb scan? And then I make a decision, okay, do this test, do that test. And then finally, when we've assembled all the information, because you don't want to leave the doctor's office without knowing what's going on.
Right.
So I make the diagnosis, I give the patient the instructions, but it's not over with yet, because then we have videotapes and we have special productions where they can go and see an animation of what their problem is. Let's say it's glaucoma, cataracts, need for corneal transplant, or they've had an injury. They can see those videos, and then after that they see a counselor and make their decision. Do I want to have surgery? Because mostly I'm a surgeon. And they have to make that decision. Do I want to have this surgery? This is the risk, this is the benefit. And often, after all that, then I talk to them again to make sure they understand everything. Because there was a study done that showed that when patients go to the doctor and they interviewed them afterward, they lost 80% of the information. They only got 20% of what they were told. You know, it's like the bad teenager. They come out, you say, well, what did the doctor tell you? And they go, nothing, right? because it's too much information. You can't possibly. So we have lots of handouts and information for the patient, models to show them, video to try to educate them.
Sight and sound.
That's the best stuff.
Sight and sound.
Right? I think that's why we're here today, right? Sight and sound.
You know, tell me about your experiences going to different countries. And you dedicated your time.
Right.
Tell me about that.
Well, it's interesting. You know, I mentioned that we just did this little boy, a 14-year-old, because I donated my part of a surgical fee. He only had limited insurance. So I've gone to sort of helping out people more locally because, you know, I have 5 children. I now have a horse farm with 30 horses on it. Out in Kennett there. And so it's a little harder for me to get away.
How about the horses you do? Do they have the cataracts?
They do get cataracts. I don't do that, but I take care of a lot of medical disease. In fact, one of our neighbors brought over a goat this weekend.
A goat?
With keratitis, and I treated them, and she texted me yesterday that the goat is doing fine.
Oh my God. You didn't milk him?
No. But one of our last trips were with my children to the Turks and Caicos, in the Caribbean. And what people don't think, they think, oh, I'm going to the Caribbean for a vacation, but there are many islands in the Caribbean that are in pretty tough shape. Yeah. And the Turks and Caicos, Grand Turk Island is one of those places. And I did about 40 cataract operations in 2 weeks there, took care of the population. And I've been to Haiti.
I've been to time and
yes, right. It was funny, on the trip to the Turks and Caicos, my children were at Westtown School, and I think they were sophomores or freshmen at the time, and they wanted to go volunteer to build basketball courts in Honduras.
Right?
So I said, wait a minute, we'll do our own mission.
Yeah.
So I put together this whole thing, and the next year we went and did an eye mission, which was lots of fun.
Tell me about your musical background.
Oh my! Well, with the 5 children. One of my daughters is Kelsey Rose Siepster. She's the one who's an actress and will be in the...
Well, we could use her in our Center Theater.
She's going to be in a...
John Doyle. All right, go ahead.
She's going to be in a pilot called The Cocaine Cowboys. But she, when she was young, we always did guitar, because I play the guitar, the piano, the clarinet.
Oh, my God.
We're
going to put a show on. I'll sing, hey, goodbye, she wants to naughty, she's on a... Hey, we got 30 seconds. Wrap it up. What's best for people today? Their eyes are so important today.
Well, you know what's really important, Hank? I really want to get it out to the local population to get their eyes checked, to have the pressure in the eye checked, so that if they have glaucoma, if they have a parent with poor vision, any history of glaucoma in the family. And when they come to Thanksgiving dinner, they don't say, I have glaucoma. You got to ask, And have the eyes pressure checked and the vision checked every couple of years after the age of 40. That should be the message to Norristown.
Okay. Well, the last time I went there, I thought that my eyes were like, I don't know, it was sore, and you checked it and everything, so I'm doing good.
You're doing
Doctor,
great.
Thank you so much. Ladies
Always a
and gentlemen.
pleasure.
I'm sorry, again, I'll sing a song next time. But I just want to thank you for coming here, and it's so important, especially now. This will be my first show for the year of 2015.
Well, that's great, because it is...
How long you been in this business?
35 years now. And don't forget, January is Eye Care Month.
Well, this show is Comcast 45 and Verizon 45 and Comcast 28, and it covers a good bit of market. So, ladies and gentlemen, thank you very much. I had to get a throat doctor here.
Next show.
But it's been a pleasure, and I want to say that I know that there's an insurance company that says you're in good hands. Well, I'm in good hands with a doctor like Dr. Siepster, who has offices in Plymouth, Upper Merion, King of Prussia, and Radnor. So he covers the area like the dew. Okay? So until we meet again, keep bobbing and weaving, and may God bless each and every one. And be on the lookout. Okay? Thank you.
Okay, thanks. Hey.